Today's question is about lower back pain post-surgery. So if you've had a PAO or a hip replacement, then this hopefully will be useful. Now we're talking about muscular hip pain today. If you're not sure whether your pain in your lower back post-surgery is muscular, then please check with your local physio or send me a message. I'll be happy to chat about it. There are many reasons that lower back pain can be happening. We want to make sure that we're targeting the right thing before we move forwards with strategies to help. Many things will be trying to compensate to keep you strong and keep you stable whilst your hip is healing. So when we're looking at the lower back pain, there are so many muscles that are sitting in that tiny little area below your ribs, above your hip bones and in towards your spine. There's too many to mention in this video, but we're going to look at the fact that all of those muscles combined will do forwards movements, backwards, side to side, rotation. There's going to be a lot of movements going in there from all of those different muscles. So there's one exercise I'm going to show you that's going to address quite a few of those today. One simple exercise that we can do, and if you guys want more and you want to know a few more specifics or a few different directions, let me know in the comments and I will put together a video for those afterwards. So the one exercise that we're going to do is going to take one arm across the waist. We're going to take the other arm up towards the ceiling. We're going to really reach up nice and tall. We're creating length between the hip and the ribs here. We're going to reach across the body. Now from there you should just feel it up the side. If you now keep reaching up and across and slightly forwards, you'll feel that going around the lower back. If you come back to the middle, you're reaching up and across, and you lean back slightly, you'll feel that coming around to the front. The reason that we take the arm across the body is to try and keep the pelvis nice and stable. If I take the arm down by my side and I reach up and over, you'll see that this hip really wants to come off the chair. So we're going to try and keep that down, and having that arm across can just give us that little bit more grounding and keep those hips nice and level. So if you are happy that you know that you can keep your hips down on the chair, we're going to take a hand on the wrist and we're going to really use that other arm to stretch up that little bit further, get a little bit of extra reach as we go up and across, and then maybe slightly forwards, back through the middle, slightly backwards. Find the area that feels a little bit tighter, definitely not sharp or painful, but a little bit stretchy, and you're going to just hold in that area and just breathe. So for example, in myself, I'm going up and across, slightly forwards here, and I can feel that really nicely down through the ribs and the lower back. So I'm just going to hold that and just take a couple of breaths in that position, and you'll find that as you take those deep breaths, you'll feel that stretch being a little bit more powerful. And then as you breathe out, possibly feel that you can just take it that extra millimeter or two on the breath out as you relax. And you take another deep breath and you just do that for maybe a minute or two in that position, gently ease out, and then next time go back in, find another position that feels like it's tightest and work through that again.